Hi there. This is going to be my video for Clinical Internship 3 Readiness for Practice video. I do have the points here on my laptop in front of me, so I will be looking down on them so I don't forget, and I'm going to be going through them and answering them as best as I can. So for my off-campus internship this semester, I have it online with my instructor Melissa, and it is on palliative care. So reflect on variables such as prior learning. I don't have any prior learning experience other than what I'm doing right now online, the palliative care. I've never had the opportunity to work with any palliative population as a student of the massage therapy program. So far I think it's a really good learning experience. We will be potentially introduced to these kinds of situations and clients in practice. Any kind of clinical experience. So no, that kind of reflects on my prior learning experience. I don't have any clinical experience with palliative care, and unfortunately, just because of COVID, we do not have the clinical experience this time around either because we have to do it online. I think it would be a really good experience to do a clinical, like an in-person clinical for palliative care. I understand that with the limited numbers because of COVID, and they do have to be careful of the palliative care patients, that we can't really be exposed to them, or rather, they can't be exposed to us. That's much better explanation there. So yeah, I don't really have any clinical experience other than what we're doing right now, which is more theory based. Of course, reflecting back to the prior learning experience, we're learning right now about palliative care that palliative care is basically can be a transition to the end of life due to many diseases or factors. That we did learn about these illnesses and diseases in our previous classes, so clinical skills, pathophysiology, physiology, special populations. We did learn about these kinds of different diseases and how to manage, not really manage, but how to, I guess, adapt our treatment techniques based on how the patient is presenting with the illness that they are diagnosed with. So that's probably the extent of my prior learning experience, but I've never been interacting with a palliative care patient face to face, me doing techniques on them. No, it's just theory based. That's probably the extent of my knowledge there. So no clinical experience at all. Personal experience, aside from me being in the massage therapy program, I do have some experience with palliative care, especially with my grandparents. They were in palliative care, but not anything related to school, and that's basically the extent of my experience. However, my experience was a little bit different when it comes to personal experience because my grandparents do live across to a different country, so I didn't have that like emotional attachment to them as many people do with their grandparents, or as most people do with their grandparents. I don't really have that, so I didn't. So when I knew they were in palliative care and they were suffering, and when they eventually did pass on, I didn't have as, I think, emotional of a response or reaction as some people would have, or my parents did, right? Because those were their parents. So it was very different for me. So I actually haven't. So I guess personal experience wise, it's very limited. Like it's not really applicable. I guess because I've never experienced it face to face again, right? So this is very new for me. I've heard about it. I've seen people being emotional around this kind of topic, and with their family and relatives in palliative care. Like I've seen them become emotional. I find it really hard to relate that way because I've never, again, been in that kind of mental state, of course, emotional state of, I guess, loss and grief. The first week of clinical placement, that's another thing we have to reflect on. Again, it was just kind of online, right? So it was a little bit different. I have had a previous online clinical placement as well, which was with Caroline, and that was chronic conditions. So I did have that I have the experience with that online. But as far as palliative care, how was the first week? It was pretty good. We just basically talked about the basics about palliative care. We went through a PowerPoint. We kind of talked about MAID, and we talked about the grading scale, basically of it's like a scale basically that determines how capable the person is with kind of daily living. So we kind of focus on that, and usually nurses will provide a percentage of what the patient is at, and of course, if it's at 100%, they're able to do things on their own. They're fully compliant of doing these things, and of course, if it's the closer to zero, the more eventually less they're able to do these things, and eventually become bedbound and potentially pass away. So that's what we learned first week. Emotions, attitudes, values, assumptions, and beliefs based around palliative care. I kind of touched on this before. Emotions, of course, it's very sad with the videos that we have been watching thus far. Very sad to see these people in these positions. Of course, I feel like some of them, correct me if I'm wrong, I feel like some of them mentally prepare throughout this process, because again, palliative care may be very short, of course, in span, but also can be very long, right? Someone can be in palliative care for a long time. So I feel like sometimes the person or the relative has time to prepare for these moments. Sometimes it becomes easier, but again, it's also very hard to watch your relative or friend or whoever it may be that and is close to you in palliative care. It's very hard to watch them suffer, and it's just overall like sad, I guess, thinking about loss and grief and how you can cope without them and the impact they have had in your life in the past or now. So of course, losing important things to you, right, is very detrimental sometimes. My emotions personally, I guess I can relate to how I reacted to the videos that we've been watching in class. I was sad, of course. Like, I kind of get more emotional. I don't even want to say emotional, because I get sad, but I don't cry or anything. Again, I haven't really personally experienced it, so it doesn't really pull on my heartstrings that much. But I do find it, I think, more sad. I don't even want to say more sad, because it's sad either way, but I get more, I guess emotional is the right word, when I see kids kind of go through these things. Like, kids are in palliative care, and that's really sad because they're still really young, and they want to go outside and play with their friends, or be better so they can go to school, or see their parents and stuff, and that's really sad. But again, I haven't had that kind of an emotional release to these videos, because again, I've never experienced it before, and I don't really have a lot of contact with palliative care patients, unless it was overseas with my grandparents, which it wasn't. I can't really say it's the same as if a granddaughter, a grandson, daughter, son was in the hospital with their parent that was in palliative care. Like, I don't have that close bond with my grandparents that way, so I don't really have a lot of experience with it. So I don't think I have as much of a reaction to these videos as much as my classmates do, which is totally fine. Like, I totally respect their emotions, and I feel sad too, but I don't know if it's like okay that I'm feeling, like, not as emotional about it. I think I'm pretty good at containing my feelings more so. So that's kind of my thought on my emotions. Confidence. My confidence, if I were to go into palliative care, I guess we can talk about that. I think I would be pretty confident in going into a palliative care if we had that opportunity, because again, I feel like I'm not as emotionally, like, it doesn't really emotionally affect me that much. It's really sad, but again, I feel like I can put my personal feelings aside to do the tasks that make them feel better, and I feel like that wouldn't get my emotions wouldn't really get in the way of me helping them feel better. So I feel like I would be confident in that way. Of course, a lot of them, they want to talk if they can, and they, there's that risk of transference and countertransference. But I feel like, Of course, countertransference and transference, sometimes it's not avoidable, but I feel like I'd be able to control it pretty well. And of course, you want to show a little bit, you don't want to be a robot while you're with them, right? You want to show some kind of sympathy for them and some kind of reassurance for them, because that's kind of what they crave as well, like social interaction, right? So you can't all completely be closed off. It's kind of like use your best judgment, I feel like, as a massage therapist, right? Strengths and weaknesses. Another point we have to reflect on. A strength, again, I'm very good at putting my personal feelings aside and doing the task that is at hand. I'm very good at that. I'm very good at also communicating, like general talking, sparking up a conversation with somebody. Like if it's a sad topic, I try to steer the topic into like a more happy direction. So I'm pretty good at that. Weaknesses. You know what? Sometimes I do get uncomfortable if it's like an illness I'm not really particular with. And how do I adapt my massage techniques to help them feel better, but also keep their safety in mind, make sure the risk doesn't outweigh the benefit, things like that. But of course, another strength that I can kind of back it up with is I like to ask questions, and I like to I'm more inquisitive that way. So since that weakness, like that's one of my weaknesses, I could always, if I was in that situation, even in online right now, I can always ask the teacher, and I know she would give me like the best response as to how to handle the situation. And then kind of give me her best advice as to how to handle the situation, how to adapt the treatments, so it's benefit for the patient. And that I think is all for the variables that we have to reflect on. So thank you very much for listening to my Readiness for Practice video. Thank you.